Thinking about everything you've been through, the whole cancer journey, do you think anything could be improved? Do you think anything could be changed to make the way we handle things a little bit more easy for patients in the future?
I think, comparing my two experiences, I think in the first case, people were much less upfront about the possibilities. And had they been, I think I would have been more comfortable with things. In the second incidence, it did help for me to be told what was going on, what the process was going to be. I needed to know that. Again, I don't think everybody else would necessarily need to, but for me, it worked to be told quite clearly what was going to happen, what the situation was, and what the likely outcome was going to be.
What could we do from the hospital perspective to improve things then? For example, could we have more support in place? Could the information network be better? Could the communication process be improved?
I think it would have helped me to have seen something like this.
Yes,
before the operation, or maybe even to have spoken to people who had gone through the same process. I think that would have been quite useful.
Yes.
I feel that my surgeons and the nurses gave me the information I needed when I needed it. When you're out of hospital, I'm not quite so convinced that the going home process is quite as good as it might be, the discharge. That certainly took a long time for me on the Friday. I remember I'd been told in the morning I was going to go, and we didn't get out until about 6 in the afternoon. So that, I think, could have been a little smoother. And when you're then handed over into the community care, that was again perhaps not quite as smooth as it might have been. That's not to say, things didn't work in the end. They did. It just took a little bit longer, I think, than perhaps I would have liked.